Everyone, thanks for being here today for our December partner panel centered around LGBTQ advocacy. We're recording this session just for those who aren't able to be here in attendance, and it will be available on Source's YouTube channel. My name's Katie Nelson. I'm one of the Source program assistants. In my role, I help support planning these partner panels to give our community-based partners an opportunity to sort of share the scope of the work that they're doing in Baltimore City and provide students with sort of, some more information about ways to get involved. So we're really lucky today to have three of our great partners with us. And so I really want to give them an opportunity to share the sort of the mission of their organization, what types of work they're doing with LGBTQ communities. And if at any point any participants have any questions along the way, please feel free to drop them in the chat and we'll make sure that they get to those questions along the way here. And so I would love to have Jeremy LeMaster, the executive director from FreeState Justice, will kick us off and tell us a little bit about their organization.
Great. Thank you so much, Katie, and thank you, Source, for having us all here today. I'm really excited that you're providing sort of a spotlight on the amazing work that is being done for the LGBTQ plus community in Baltimore, as well as the work remaining to be done. And so definitely happy to be joined here with you all today. So to start off, my name is Jeremy LeMaster. Pronouns are he and they. I'm the executive director at FreeState Justice. I've been here a little over a year and a half. Most recently, I was actually at Hopkins. I was a research program manager in the epidemiology department of the School of Public Health. I was working on the Max Wise HIV study. And so I definitely got very familiar with Source when I was there as an employee, very much appreciated the work that they did. And now I'm very excited to be sort of on the other sort of side of it as a community partner to continue, collaborations moving forward. I do have just a few slides that I'll just kind of be going through today just to kind of help ground and orient folks. I'm always a fan of having visuals to go along with things. So in terms of FreeState Justice, we are a 30-plus-year-old organization here in the state of Maryland, formerly known as Equality Maryland and the Free State Legal Project. We merged in 2016 to be the first organization nationally to combine direct client legal services with our LGBTQ plus policy advocacy work. It's a model that we've now been able to export to other states. So Equality Ohio, for example, is one of our main sort of allies that we really helped in getting their legal services program off the ground. So that being said, half our team are attorneys, working on cases in-house, as well as looking to place cases with pro bono, attorneys across the state. So when it comes to legal services, there are a number of different issues that we address, ones that have unique impact on LGBTQ plus community members. But typically this looks like doing name and gender marker changes, working on any LGBTQ plus based discrimination in employment, accommodations, housing, or healthcare. Doing a lot of work to support LGBTQ plus parents and children in cases related to family law. LGBTQ plus people are routinely discriminated in things like divorce proceedings, custody hearings, and things of that nature. And the last is really just around health insurance denials. We still see consistent denials of coverage for trans folks in gender affirming care. So it's a kind of continued issue for us to address through legal recourse. Our next bucket of work is really around advocacy and outreach. We continue to work on state level policy changes. Even though we've had, even though we live in a rather progressive state with a lot of protections for LGBTQ plus community members, there definitely is still a lot of gaps that we're really working to address and fill, and really ensuring that LGBTQ plus folks who continue to be disproportionately impacted across the board by poverty, our criminal justice system, healthcare, et cetera, that they are being centered and sort of brought to the table in any policy work. And then last, we do education and training. Once we've secured policy rights and legal protections for folks. We want to make sure that both our community is aware of the rights that they have as community members, and then also educating our allies to better serve our community members and making sure that they're following the law. And so we do offer a range of trainings, both with our attorneys as well as a lot of our program staff to really suit the needs of individual organizations. So for FreeState Justice, our mission and vision centers low-income LGBTQ plus folks. And so as a result, we believe that by centering the most marginalized within our community, we can have the greatest impact for the entire community. So to that effect, we really ensure to examine the unique needs of trans and gender nonconforming folks, people of color, and especially Black Baltimoreans, youth, elders, and those that are geographically underserved. So even though we do, the majority of our casework, about 85% is in Baltimore City respectively, that there's the higher concentration of people of low or limited incomes in the city. So that's why we're based in Baltimore and why most of our clients are in Baltimore. But we do serve, folks across the state. And so a lot of work recently has been around expanding access and social support to those in rural areas. So today I'm here just to really talk about ways that students can get involved, not just through SOURCE. Formally, we work or collaborate on a number of different SOURCE programs, but even outside of SOURCE, there are other ways to get involved. The first one is by joining one of our board committees. Our board of directors has a few different committees that are open to the public. You can join any committee as a non-board member, and that's one way just to sort of get involved with the direction that our organization is taking and on helping us with how we're tackling different problems, both internally, structurally, in organizational capacity building. You can really help us as an organization grow, but externally as well. So like our policy committee, for example, is a very large committee to kind of exist as a sounding board as we navigate the legislative session. We also do accept volunteers. Currently, we do a lot of volunteering around the legislative General Assembly session in the spring, but there are other volunteer opportunities outside of legislative work. This looks mostly like supporting any in-person events that we do, either tabling or legal clinics. We've recently received grant funding to incorporate COVID vaccination as part of our legal clinics as well. And so the more volunteers that we have to kind of help staff and support folks, the better we're able to serve the community. Additionally, besides that, we do have a number of formal sort of internship opportunities, as well as sort of a DIY design your own type of opportunities. Are very much open to folks who come to us with either research projects or practicums or things like that they are looking for host sponsors with. And some of our best work has really come from collaborating with graduate students on different projects and some things that have sort of stuck around even after our graduate students have left, which I'm really excited about. So we do have formal and sort of DIY opportunities available. Some examples of just some of the previous SOURCE specific projects, over the years, SOURCE students have helped us in the designing of a client satisfaction survey. Just this past year, we also had a group of students work on creating a validated measure for self-sufficiency for us to administer both at point of intake as well as 90 days post-case closure, just to better assess the ways that legal services can impact an individual's sense of self-sufficiency across a number of domains. We had 2 students working on redesigning our client outreach work and providing sort of recommendations for SMS texting and integrating that into our client follow-up. Someone last winter did a landscape analysis for us on available LGBTQ plus immigrant resources in the city. That turned out to show that there really weren't a lot of LGBTQ plus specific immigrant resources. And so definitely we're in the next stage of needing student support to kind of move that project forward. We've had students work on a really interesting analysis on sex work related crimes because sex work, our community members and specifically trans community, trans women who are sort of profiled as street-based sex workers consistently have interactions with police officers, being detained for police officers, and just reports from the community that they're being detained without arrests, in addition to being vulnerable to sexual violence. We've started to kind of do an analysis to kind of help provide additional evidence to these claims. And the big one that's ongoing right now is just a geographic analysis. So we do know that our community, performs street-based sex work in certain zip codes and areas of the city. And so actually kind of doing an analysis to determine if these areas are policed any differently than other areas, and just try to shed some light in the disproportionate policing of our community. That same person also worked on a stigma scale. A lot of stigma scales focus on the internalized stigma that folks face. And instead, the idea was, how can we assess the stigma that the surrounding community has against sex workers? And so that was really an interesting scale that was developed that we're hoping to implement in our upcoming needs assessment. We've had in the past people help us with cost benefit analysis of different strategies for conducting a needs assessment. Every legislative session, we are always in need of support in developing policy advocacy toolkits. Those have been really effective in the past. And then, we do have a youth dedicated coalition called the Youth Equality Alliance. One of their main activities has just really been the cultivation of GSAs, or gender and sexuality alliances, across the state, and a lot more youth-facing sort of work and sort of empowering youth to be their own advocates. So kind of additional projects that you could potentially collaborate with us on include just grant writing projects. We do a lot of grant prospecting in a lot of different issue areas. So even if you come to us with an issue area, we're more than happy to kind of collaborate on trying to identify funding sources for that work. Policy advocacy toolkits, we still need those. We have a lot of priorities this coming session, but some of the bigger ones are related to decriminalization, identity documents, healthcare, and non-discrimination policies. We are looking to develop a more 360 approach to client support. We only provide legal services, and so it is a challenge when people come to us looking for justice, and often there isn't legal merit to a lot of cases that folks come to us with. So how do we kind of design support in a way that folks can come to us with a problem and we're still able to deliver some sense of justice for individuals, even if they don't have legal merit? We are looking for individuals to help in sort of continuing outreach to immigrant communities, and specifically Spanish language speakers. And then even just outside of legal support, we're looking for individuals to kind of help develop these sort of public benefits or administrative document navigation, just providing a helping hand in navigating or guiding folks in sort of filing different types of paperwork, different complaints, et cetera. And then even beyond that, I think, there's opportunity for just individual research projects. We migrated to a virtual case management system a little over 3 years ago. So we have legal case data from about, I think, 10 or 15 years potentially, that we've really just not had time or capacity to do any sort of research or analysis on. One sort of big question that we would love to answer is, does legal services lead to reduction in things like recidivism rates, for example. And so I think there's a lot of opportunities for those that are interested in that intersection of legal services with other markers of public health. And then public health in general is an ongoing issue for our community. So any thoughts or ideas on how to improve public health, especially in the realm of reducing interactions with the criminal justice system and protecting or preventing violence for vulnerable community members, are definitely of interest as well. It's kind of what we look at in terms of public health work. And then outside of that, we typically have internships where folks are doing dedicated different buckets of work under the direct sort of supervision of a staff member, and it kind of spans the sort of skills. If you're interested more in writing, if you're interested more on education and delivering trainings, if you're more interested in the policy work, If you're more interested in the client interactions type of stuff, there are different opportunities that can provide that type of experience. So yeah, that is mostly it. We do have a general email address here, info@freestatejustice.org. We also do have a sort of a form, online form called our engagement form. It's a single form that you can use to fill out any opportunities you're interested in, whether that be volunteering, internships, etc. I'll make sure I follow up with the link to the form just so folks have it. And definitely looking forward to answering questions that folks might have.
Awesome. Thank you so much, Jeremy. And now we'll transition to have Kate Bishop, the education coordinator from Chase Brexton Health Care, speak with us a little bit. Thanks, Kate.
Hey folks, I'm so excited to be here with you. Thank you so much for inviting us to be part of this. We've had a wonderful connection with Source volunteers in the past, and I just am thrilled to see the programming continue. I'm going to also do a little bit of slideshow because it helps me stay focused on the things that I wanted to be sure to talk about. And say hi, I have a few friends who've come to join us today. I'm really happy to see you folks. Hi. Okay, so let's say a little bit about just what's up with Chase Brexton. From beginning, come on, slideshow. You should be looking at a slide that says Chase Brexton Healthcare because everyone's health matters. Can somebody give me a thumbs up that you're seeing that? Super great. Okay, so you may already be aware we're a federally qualified health center. I'm sorry, I can't make that stop. And we've been active for now 43 years in Baltimore. We started as a gay men's health clinic, and health clinic is a quote there. It was an STI clinic, right? So in 1978, we were seeing that gay men in this town were continually having humiliating healthcare experiences when they went to try and get themselves taken care of for STIs and other concerns, and started talking to one another and saying, you know what, like, we can do this for ourselves. We have doctors who are part of our community. Let's work this out in community, and created this volunteer clinic space in the basement of a 21st Street near North Avenue apartment. And that grew and grew and grew. We are now at a point where we're serving 40,000, mostly low-income Marylanders, about a quarter of whom are LGBTQ identified, and about a quarter of our 400 staff members are also part of the community, including me. I identify as queer. I'm part of the Center for LGBTQ Health Equity. The main things that we do, we work on both ends of the age spectrum with an Elder Pride program. Elder Pride is for people who are older than the age of 50. I'm 48, I don't know about you, but that 50 seems super young to me. There are reasons for that. Partly it's because of aging and how it works differently in LGBTQ communities than it might for other folks. Partly it's because some of the zip codes that Chase Brexton served, the life expectancy is 59. We can't start at 65 and have a program. So Elder Pride is part of what we do. The other end of the age spectrum, we have a Gender Joy program. Joy means journeys of youth here. So for folks who are between the ages of, our youngest patient there is 5 up to age 24 to the end of, officially end of adolescence. We see folks who are transitioning or just living their truth as a gender diverse individual. And for some people, I mean, that 5-year-old isn't getting any like special medical attention to their body. They're not getting hormonal treatment. They're getting affirming care that uses the name and pronoun that's appropriate for them and helps their family prepare for puberty or what might be coming up in their future. The health equity training team is what my main job is. I do training with health and human service organizations. Last year, I personally trained about 2,000 people. We train a lot of folks in LGBTQ care and lots of more specific topics under that. Please come and check out our website. We've got a whole slate of trainings that are offered. And then behavioral health care is an important part of our mission as well. We have a few therapists who are particularly focused on the community. When people call up and they're like, how should I work this out? I would like to get some therapy. And you can see the list of all Chase Brexton services here. Behavioral health is a large part of what we do. I say, you know what, like any therapist that you see at Chase Brexton is going to be like cool and get your pronouns right and like be decent to you. And if you're looking for somebody who has decided they're going to dedicate their career to working with LGBTQ populations, and we also have a few folks who exclusively work with our community. Here's just a little info about what we're looking at. I'm not going to expect that you'll get really far into these each of these categories, but I want to point out that all of the segments of our community are dealing with some health disparities, and they're different. So I often, when I'm out speaking in the world, say, you know, there's not really any such thing as an LGBTQ community. There's a loose collection of subcultures that sometimes have the same goals and needs, and sometimes have pretty mutually exclusive goals and needs. And to point out that there are real differences between us, but all of us are facing some kind of unfair, unjust health situation. And this is why that is. We start out with higher risks than general population for all of these health concerns. We have lower screening because of discrimination and terrible experiences continuing to happen to our people in healthcare. And because of those things, we end up with medical mistrust as one of our cultural values. We expect that medical and social service providers are going to treat us badly. Those are either our own experiences of being treated badly or our friends' experiences that have come through. I mean, it's very reasonable to have fear of providers when we've had bad experiences with them before. So we know that leads to compromised health outcomes for the whole community. Here's a little bit more about behavioral health care. A lot of what we do is write letters for folks who need support for who are seeking surgical procedures for gender confirmation. We know that those letters are really precious, are valuable to folks, and we want to make sure that people have access to that as a service. You know what? We have maybe 60 people who do therapy at some point of their job at Chase Brexton, and we're continually hiring more people. Like, we're running out of space. We just try to continue to add more behavioral health. And we know that, like, no matter how large that workforce got, we still could not possibly meet all of the need that's there. But behavioral health is a very important value and something that we continue to try and have real focus on making sure that there are providers available to the community. Adult transgender care is an important part of what we do. We have about 5,000 patients in that program now. And some folks are not having any gender affirmation medication or don't have surgery goals, are there because, again, they want affirming care. But if people do want those kinds of services, they're available as well. Basically, this is where we come to. At Chase Brexton, you're going to see people continually who will say, your gender is valid. Your transition, however you decide to express and move through that, is honorable. We're here, it's your goal. We're here to support what you're doing. The Gender Journeys of Youth program does, like I said, have patients from 4, and here it's 26. We actually have moved it to 24. And these are some of the services that are available there, including support for families who are going through the transition of their child, or they're getting used to the idea that their child is a gender diverse person, and helping those families move forward with supporting that young person in ways that help them be healthy. Here are where the centers are located. The main center that you may be familiar with and where we see the most patients is in the city of Baltimore in Mount Vernon. And here's a little bit about what source students or folks who are involved with the program might be able to help with. The public facing programs that we do, where we actually could just use people, friendly, warm folks to help, are around our Elder Pride programming. Means National Honor Our LGBT Thursday, where we have an event every night. 2 years it's been a virtual event. Elder Pride, the Elder Pride section of the Baltimore Pride Festival, we also hold that down, and I've got some pictures if I end up having enough time to show them. And those are both places where we just need warm, friendly, outgoing volunteers who can talk to an elder. That's a real volunteer job, who can help us put those events on. We have several community advisory boards that are always looking for more folks, and in the larger Chase Brexton structure. And I can give you more information about that if you contact me. We're more and more working toward moving toward multi-generational events, including a monthly Elder Pride Connection event where we have a discussion topic and a speaker. And it's lovely when those events have more people in them across the age spectrum. We know that we're here providing that for people who are older than 50, and they love and it's such a valuable experience for people who are younger than 50 to be part of those conversations. We really like for folks to be able to do that. We have had 2 nursing, it's been a few years now, maybe 4 nursing school classes who have worked with our elder population. So we know we have particularly a core group of people who could use a call to check out what their health status is. Do they need any support? And to just give them some care and connection. And then our education and training program includes topics that need research, topics that need an infographic or need to some assistance. And so we can sometimes use folks in the development of those programs. The source student that I remember working most closely with in the last few years was working on a needs assessment program instrument for us for polling transgender patients and their families about services and what their needs might be. And we need to update that so that we can continue to look at what changes may have been over the time since the last needs assessment was developed. So she worked with us about that. We now need a student who could help us implement that. So those kinds of higher level public health work are also part of what we do and part of what we could use some help with. Here's just a little more, our mission, our vision, and the values that I wanted to be sure are there. Any questions that folks have, I'd love to hear. Let me check my time. I think I'm probably up. Yep. Thanks very much for your attention and for listening. I'm going to put my email directly into the chat so that folks can just get a hold of me straight away if you'd like. And I'll be available for questions. Thanks so much.
Thank you, Kate. So great. And also your slides are beautiful.
Thanks so much. Cheers.
All right. And last, we'll hear from Traymar Wilson, the program coordinator and advocate at the Pride Center of Maryland. Traymar.
Awesome. Can you all hear me? Because it looked like you all been breaking up a little bit for me. Yeah. Awesome.
We can hear you.
All right, perfect. So first, I want to say great presentation by the 2 individuals that went before me, Jeremy from FreeState, and then as well as from Katie from Chase Brexton. You all did a wonderful job, and I don't even like to go after you all because you all did so great. So, how my presentation will go will be a little bit different. As I will be more interaction based because a lot of people may know of the Pride Center of Maryland, but in the process of knowing of the Pride Center of Maryland, I think it's really, really, really keen and important to kind of know where we are now or where we're building to, because a lot of the things that we're currently doing is under development. So I'm gonna close this door so I can start you all. I'm sorry. Great. So I'm gonna share the screen. I could just go here. Awesome. Can everyone see my screen? Perfect, perfect, perfect. As soon as I learn how to go back. Okay, so starting with introduction, you all, my name is Traymar Wilson. I am the Senior Director of Operations and Programming with the Pride Center of Maryland. I'm also an MSW as well as a Master in Public Health. So that, I believe, is what I bring to the agency. And I think when I'm here to kind of explain to you all of the work and advocacy that we do for moving forward, I would like to commend some of my staff and assistants who are here in support. We have Drew Mitchell, who is also working as my sister, who is the who's working as like an assistant director of community engagement and advocacy. And we also have some outreach coordinators here, as well as some case managers here in support. So I thank you all very much as I attempt to represent the organization the best of my ability. So like I said, mine is more interaction. I just really wanted you all to know the mission and the new mission and the vision of the organization, and anything else I can kind of explain through word of mouth, which I think will be more meaningful. The mission of the organization to be a catalyst for uniting and empower section gender minorities in Maryland, and to advocate for better quality of life for the entire community. Our vision is for sexual and gender minorities, what we call SGM, to realize their collective power, playing a vital and active role in Maryland, and working closely together to ensure that all parts of the community are thriving. Maryland can become the best place for sexual and gender minorities to live, work, and play. So what do that mean? Is some terms here that I think that maybe some may not be familiar with. So let me explain that. When I use the term SGL, I use the term SGL with hyphens. I always use SGL with partnering with the LGBTQ plus, and I partner those together within synchronous because LGBTQ plus is an overall colloquium that that advocates and explains for the community, and then SGL, which I say SGL with a slash of trans and bi individuals as well as non-binary, is has been a I guess I would say about for the last 20 years has been a term that we're known to empower the minority people within the LGBTQ plus community so that it can find a way to kind of empower and to represent the whole colloquium of all the people that no matter what part of the spectrum that they may be a part. So when I use the term SGL and SGM along the side of LGBTQ, hope that you all can understand specifically what that means. When I say the word SGM just means sexual gender minority within general. So like I said, my slides was very much simple. I wanted y'all to know the mission and the vision, and I want you all to know our two goals that have been for the Pride Center and the new development of the Pride Center. It has been to improve the lives of the LGBTQ plus and same gender loving community through advocacy, access, and communication. So now, as I actually get into that and I actually kind of explain what I mean, I would like to unless you let me know if you all can't hear me at any point of time, so I know if I need to stop or refresh. So what that means is that for anyone what's familiar with the Pride Center Maryland, previously we was also known as the GLCCB, and we had been servicing the community in general for nearly 30 years. However, the relationship with the GLCCB has been tremendously different over the years, as it didn't affirm the entire community, and specifically Baltimore, that represented the makeup of Baltimore and the population of its specific focus. So the new goals, like I said, as a new person who do operations, the new goals is to pretty much include the entire community, include the different spectrums of the community, and to kind of provide a safe haven and a perspective that allows everyone from the community to have a place that they feel safe and that they feel empowered. Some of the things that we do is we host the Pride Festival every year. So we are the, I guess we'll say the ownership of the Pride Festival. And then we do partner with other organizations that allow them to participate in other portions of the Pride Festival. So I think that's normally one of the big go-tos when people look at volunteering or want to be a part, that we do host the Pride Festival. So we are actually at this current time looking for volunteers to join our Pride Committee, and we're looking to create a diverse Pride Committee for planning the Pride for 2022. We want this Pride to be bigger than ever before, especially for not having a Pride last year. So if anyone is interested in that, I will drop my information down in the chat there. But just telling you about what the Pride Center Maryland currently offers now. So at this current time, we have been revamping our services as well as so we have a building. That is going to be located on St. Paul Street. It's right next to the Safeway off of St. Paul at 25th Street. And the building has been labeled the Empowerment Building. The Empowerment Building is going to have an inside fitness studio for those, promoting health. We're going to have a healthy cafe in there that's going to be free to the public, as well as the fitness center is going to be free to the public. We have housing. So we have housing coming up for homeless youth. We have housing coming up for a transgender individual, and as well as anyone who may be a part of the same gender loving LGBTQ plus community that's coming here in 2022. Also we're going to have a media studio within a new building, and the new building grand opening date is scheduled for the 3rd of February. So if anyone would like any more information about that, you can please go to our website or pretty much contact us, and we will be more than willing to share any of that information with you all. some of the resources that we're currently offering. We have another organization that sits under us, what we call Trans Baltimore. Trans Baltimore is now running a support group, which is called Trans Talk Mondays. And Trans Talk Mondays is will be operating bi-weekly, and it will be operating out of our current office, which is 2122 Maryland Avenue, Baltimore, Maryland 21218, which is right directly next to the I-Bar. And Trans Baltimore, through Trans Talk Mondays, will reach out to trans individuals throughout the community, both trans male as well as trans women, and looking to pretty much create some type of support structure for them. What we decide to do now, that's going to be a little bit different than other organizations. Rather than just offer specific services, we're bringing them together for a trans focus group to find out what services that they would like to see in the community, so we can make sure we're actually advocating for them correctly. So what that means, like I said, bi-weekly we meet, on Maryland Avenue, and we kind of just launch what service they want to see out of there, what programs they would like to see, what kind of events they would like to see, so we can ensure that those will happen. All of our programs that is launched, we have a membership process that if you sign up to be a member with us, the membership is free. It gives you access to all of our amenities, as well as it gives you a free spot to the Pride Festival, as well as being able to participate in the Pride Parade that occurs every year. So that's something definitely to look forward to. At this current time, out of my specific office, I am taking internships for accreditation. So I have some master students for public health. I have some master students that's actually from the Johns Hopkins University, and some other students. We are taking internship opportunity for accreditation for master's level as well as for bachelor's level students. So also, if you're interested in that in any capacity, please feel free to, like I said, to get in contact with me as I drop my information down within the chat. Some other resources besides Trans Baltimore, we run preventive health clinics, and preventive health clinics occurs normally on Tuesday, where we send our outreach team out to outreach in the community to just inform them on safe health measures. We also do night outreach to target, to target specific populations, whether that's the homeless population, whether that's the population of those who may have to participate in sex work. We just provide, safety measures, we provide resources, we provide food, and also transportation, just to ensure that we're providing the best type of safety net that is possible for the communities that we specifically serve. At this current time, also, we're running two campaigns. One is a COVID-19 campaign, which is looking to help get the sexual gender minorities or the LGBTQ individuals vaccinated at higher rates within the community. And what we do is we incentivize vaccination, but we also ensure that we go with members from the community to get vaccinated, and we create vaccination sites. So what we can do is to ensure that those people actually, like I said, feel represented and feel like the place that they're going to receive services understands that gender identity, that sexual orientation, and any other standpoint that is necessary. At this current time, we're actually running a substance abuse program that we're looking to promote for it to be a national program. The national program will be one of the first substance abuse programs that specifically creates a 12-step program that's specifically for the LGBTQ plus community. As you all know, there's multiple substance abuse programs that maybe have an emphasis that they are friendly to the LGBT community, but we have a specific program that targets the LGBT community that we have seen to be effective, that we are working with specific stakeholders and as well as people within the government at the state level and federal level attempting to get this to be a national program, because we have seen that the efficacy of it can work, and it actually can prevent substance abuse use, but substance abuse misuse specifically within the LGBTQ community. So that's another standpoint that's like I said, national campaign that's being launched. And then I would say finally, we have another national campaign that will be launched on February the 7th. It'll be a video campaign for, I believe it's for the National Black HIV Awareness Day. And that campaign will be targeted to specific individuals who may be positive or individuals who have partners who may who may be negative but have partners who may be positive, breaking the stigmas of of HIV, breaking the stigmas of, the ideas that, that these two, like, it's not a death sentence, that's a deal that, that pretty much you can live a happy, wholesome life with a partner that love you, and both of you all can still be safe within the process of still being in love and, being together. So like I said, that campaign is something that's launching that we'll be partnering with Gilead and some other organizations on that specifically. So as I wrap up, I just want to thank all of you all again for taking the opportunity to hear out this presentation. And as I didn't provide you much or any of these slides, what I wanted to ensure is that you all was aware of all the building that the Pride Center Maryland is doing and the development that is here to come. And we would love for students and from diverse spectrums to come and actually help along that process. And if you all have any questions, I will leave it at the end to be an opportunity for you all to engage in any way possible. Thank you.
Thank you so much, Traymar. An incredible amount of work being done. Wow, so great. Traymar, we actually had a couple follow-up questions. Kate asked in the chat, is the Empowerment Center location open for walk-in needs at this time?
So the location of 2122 Maryland Avenue, we are open for walk-in needs from 10 to 5 p.m. And I will drop the address in the chat. Now it's 2122 Maryland Avenue. However, the Empowerment Center specifically, we are going to start opening in January. So we want to get through the new year. We want to make sure all our ducks was in a row. We really want to make sure it's the best center that's really targeted to empower people. So like creative design, we have some mural things going on. We have, we just want people to come and express themselves and hone those talents for free and be able to be wholesome within the community.
Awesome. And then another question for you. Are your Trans Talk Mondays currently happening?
Yes. So the next Trans Talk Monday will be occurring this upcoming Monday.
And where can people find the information for that?
Yeah. So is
that on the website?
Yes. So it's on Trans Baltimore. So it is transbaltimore.org. And then we also have 2 coordinators who are trans individuals, and we'll bring on another coordinator. So 2 coordinators who are trans women, they will bring on another coordinator that will be starting in the next coming days, will be a trans male, to make sure that we're actually solidifying to both groups. So with that being said, I drop my name, my phone number. I'll also drop my email as well as the link to Trans Baltimore, and you all can contact me whether it's through email, through phone, and I will get in charge with the coordinator of these services. Because just to bounce that off a little bit, we have a lot of things that's going on with that. We're going to provide free clothing swaps. We're going to provide free makeovers. We're going to be providing job, help with job searches. We're going to be providing resume rebuilding. We're going to provide certification. We every time we sit down in a breaking bread model that we allow you all to come to dinner. We kind of get comfortable and feel that open form so you all can talk freely, and then we're able to build on top of the services that's actually adequately needed in the community.
Perfect. That's great. So while we wait for some more questions in the chat, I think we have time for maybe one sort of big question for each of our panelists here. So I'm going to group this into one question, but sort of 3 parts. So I think something that a lot of students wonder about, especially, over the last 20 months, obviously the COVID-19 pandemic has changed the way that we work with communities. So I'm curious to hear from each of you. How have your organizations pivoted, if at all, during the pandemic to continue meeting the needs of the LGBTQ communities in Baltimore that you serve? What do you find personally or, within your role to be the biggest challenge in doing this type of work? And then to end on a high note, what's one thing that gets you out of bed every morning to continue to do this impactful work? Anyone feel free to jump in.
I can go ahead and start off. So I think one of our biggest challenges as a legal services organization was the courts were closed for a long period of time, which really more or less put a halt to a lot of our services. But it did at least allow for us to kind of do a lot of very important infrastructure updates. So over the past year, there's been way too many tech improvement projects, data cleaning projects, et cetera. So I think that was sort of one good pivot. It kind of gave us a space to kind of take a step back and look at how we're setting up our systems and structure. So that was really the one big pivot. The second is really then, focusing more on virtual service delivery for legal services, and recognizing that there are a lot of things that can be done virtually that we typically used to think that could only really be done in person. And so, working more to have hybrid style legal clinics has really been the one major pivot. But honestly, I think one of the, brighter sides of the pandemic has been, we've really were able to start to engage with people across the state a lot more. Suddenly our board members who struggled to get to our board meetings that were in person in Baltimore had no issue hopping on a Zoom call and zooming right in. So we've really dramatically sort of enhanced our access, being able to reach folks from and start cultivating partnerships from the Eastern Shore to Western Maryland. And so that for me has been one of the kind of better shifts. I'll kind of pause there and let other folks talk for the other parts.
Awesome. Is it still on you, or are we passing to Pride Center? Is that okay?
Yeah, passing it to you.
Awesome. Thank you, Jeremy. And it's good seeing you again, by the way. It's definitely good. Awesome. So I think prime example, I think the first question, kind of the sub question you asked was, how did COVID kind of change our work? For me, it affected us tremendously. It affected us tremendously because this was a completely new virus. It was something that was kind of unforeseen, but specifically with our targeted population, how we have to service that population, virtual services was not really adequate. And the reason why I say that is because if we think about all the social determinants that the LGBTQ same-gender loving community already face, take those social determinants, and then you look at like why they have higher substance. So LGBTQ actually have way higher substance abuse rates and things like that than the heterosexual community. And then when we take those, when we look at those standards, we say, okay, the LGBTQ community already go through these social determinants. Then you add the social determinants of isolation in there, add depression in there. You add, not being able to connect well with other people. Some people not having intimate lives or intimate partners. And then you think about not having community gatherings. Then that just adds more social determinants that affects mental health, that affects stability, that affects, the drive of development within general, which puts a huge pressure on the community we serve. So what we realized that some people, kind of like even people we were servicing kind of ended off worse off after, due to COVID, which made us be one of the organizations that we had to jump in person immediately. We did COVID virtually for a while. Then once we started getting these statistics, and like, okay, well, I'm going to get vaccinated. I'm going to do whatever I need to do to get vaccinated, and my team will get vaccinated. And we have to go out there and be able to be on the ground for our community because we provide direct services that they need. And just because, COVID is what it is, that people are still homeless. People still don't have access to food. People don't have access to proper Medicare. People don't, so all these things are still occurring. So for me, it affected immediately in the beginning. And then I kind of just, grabbed my team like, hey, we got to get back on the streets. We got to do what we got to do. Whoever, I understand if no one want to do it, but we got to make this happen. And, what it's going to take. And then my team was more than willing, like, hey, we're getting out there. We got out there. We did wonderful things. We're still doing wonderful things. And it makes me proud because it affected, but at this point, we've been open now for already, 9 months, working, throughout the pandemic, and, knock on wood, and thank whoever, we have had no sicknesses. We have definitely been servicing the community. So for us, it affected us in the beginning, but now, like I said, we're stronger than ever. Team grown over 30 within the last 2 months. So I am proud and happy with that. And then lastly, I would say, we'll get you out of bed. You all, if I be honest, you all get me out of bed because there's so many great people here. There's so many future leaders here. It's like you all are the future, and even the ones who've been doing the work prior to I've been doing the work, you all were the motivation for me to be the future. So I think what gets me out of bed is knowing that there's still people that need to be helped, and there's still people out there that want to learn and get the experience with helping these people. And if it wasn't for you all, I wouldn't be here, and I probably still be laying down right now. So thank y'all.
I'm very inspired. That was fantastic. I'm so happy to hear what's going on right now with both of your organizations. I've been a fan for a long time and been following along, and I'm excited to see the pivots that have happened that have allowed you both to continue operating at such a high level. COVID changed everything about healthcare, right? So what we have been facing are doing testing, treatment, and vaccination for the last 2 years, right? We're trying to just keep the entire community healthy, and that's really been an enormous challenge. LGBTQ people were disproportionately impacted by COVID, as were folks who are in all marginalized positions, right? Like the existing inequities in healthcare were exacerbated by the pandemic hugely. So we're seeing people who are having higher needs than ever, having less capacity than ever. One great thing about the pandemic, we immediately moved to telehealth for almost all appointments that people can connect with their provider online. Fantastic for individuals who are isolated or in parts of the state where it's pretty tricky to drive to Chase Brexton, right? So to be able to have a virtual appointment has expanded access, particularly for trans youth, but across the board for gender diverse individuals, being able to connect with services. That's been a big deal. Groups are hard to run. Behavioral health groups are hard to run over telehealth, although we have continued to do that so people can connect. But I will be excited for when people are able to be in person and breathe together. For my specific work in the education sector of the world, I gotta say, I would never have wished it, but we have really been able to ramp up our education and training efforts because training online is now normal. It's now expected in the way that most people are getting education in this point. So we've been able to reach a lot more folks, and that's an exciting move to me. I'm thrilled that that's been able to happen. The biggest challenge is that our people are suffering, right? Like the LGBTQ folks face health disparities in every sector, and low income people face health disparities in every sector, and people of color face health disparities in every sector, and on and on and on, right? And we are trying to kind of be all things to all LGBTQ people as far as health is concerned, and that's impossible. So those tensions are part of what's difficult in my work, making sure that everybody's getting the services that are needed at the dignity and respect that they deserve is a kind of constant round and round, right? I'd say what keeps me moving is how much work there is to do. That doing education with healthcare providers, I'm out here working for my people. Like this is absolutely mission-driven, dedicated work for me. I'm out here trying to tell our stories in ways that are evidence-based, but are also compelling and help people find their personal motivation for stepping up and doing better with LGBTQ folks in interactions, but also in advocacy to change the state of healthcare disparities among LGBTQ folks. That's where I'm at.
Amazing. And then it looks like we have time. One question in the chat. We love volunteer opportunities, but what does the landscape look like for any sort of paid opportunities at your organizations?
I'm gonna go ahead and start there because healthcare is, I think, probably a place where a lot of folks on the call find themselves somewhere in the realm of. And turns out we hire a lot of healthcare folks. We hire providers. So particularly behavioral health providers are needed right this minute. Nursing and medical providers also really important. We also have a population health department, which uses folks from public health sectors. There are lots of places to show up and be part of the work at Chase Brexton if healthcare is your field.
We're currently, we just kind of finished a hiring spree on this past fall, but there are still a few things that we sort of have on deck in the spring. One is, paralegals. Paralegals are extremely useful in helping out our litigation team, and additionally to also provide some form of case management for clients as well, especially with things that are not quite legal, but still could use the help of a professional in sort of working with. And so between paralegal support and then just kind of more general case management support, trying to do resource navigation. As noted, we do legal services, but often our clients have a constellation of issues related to healthcare, housing, and mental health. So having someone on staff to really be dedicated full time to resource navigation is definitely in our cards to make sure that people are getting piped into Chase Brexton, Baltimore Safe Haven, and the Pride Center for these other areas of support that they could benefit from is also on deck.
Awesome. Well, I think in the spirit of not running people over into the next hour for their next sort of Zoom call, I think we'll go ahead and close out for today. Thank you to Jeremy, Kate, and Traymar for spending this hour with us. And thank you for the great work that you're doing in your organizations and for the Baltimore community. Thanks everyone for coming today. Take care and stay safe.